Osteosarcoma is a type of bone cancer that accounts for about 3% cancers that afflict children.
The Taiwan Association offers free temporary accommodation for osteosarcoma patients from rural areas who need long-term and frequent medical treatment in Taipei.
FTV reporter Stephany Yang visits the home to meet the patients and the chairman of the association.
13-year-old Apple lives with her mother in Chiayi. A few years ago, she was diagnosed with a rare form of cancer called osteosarcoma. It was a frightening experience for her and her family. Apple and her mother take a taxi from Chiayi to Taipei every 6 months for a follow-up appointment at Taipei Veterans General Hospital. It's an exhausting ordeal for both mother and daughter.
Her feet would be sore. I wondered how such a small child could have sore feet. I took her to see a doctor, and the doctor prescribed her medicine, but she did not get better. Later, we took her to a larger hospital for a checkup, and she was diagnosed with osterosarcoma. I cried. At first, we didn't understand what that was.
However, about a year ago, Apple's mother learned about the Taiwan Osteosarcoma Caring Association home. The association offers free temporary accommodation for osteosarcoma patients from rural areas who need medical treatment in Taipei.
The facility has accommodation for patients and care students. Over the past year, 900 people have lived in the home.
Here, not only do they have a place to stay at in Taipei, they can also cook in the kitchen and socialize with other patients and their families. Apple's mother says it's greatly reduced the financial burden of getting care for her child.
We traveled to Taipei by taxi. It is not an easy ride. It takes 2 or 3 hours. It's 4,000 NT each time. The hardest part is that we didn't know anything when we came here, and we didn't know what to do. When we come to Taipei, it is just me and my child. But thankfully, Taiwanese are really nice, and we don't need to stay in a hotel when we come here. It's more convenient to stay here.
Another patient that stays at this home is 11-year-old Zhen Qizhen from Tainan. She was diagnosed with osteosarcoma in 2014 when she was only 3 years old. She has a follow-up appointment in Taipei every 3 months. They stay at the free home where the people feel like family.
I came here and felt that the environment was very relaxing and comfortable, just like my own home. I met a friend here in Taipei in 2018. We have been in touch since then. Going to the hospital is not so boring anymore. Since the care home was launched in July 2020, anytime we are in Taipei, we come here because it is very close to the hospital. If she wants something to eat, I will buy something nearby, come here, and cook what she likes. Also, if the hospital allows us to take leave, we bring her here in her wheelchair to play games. I think the most helpful thing is the people here. The treatment in Tainan was scary, but here I see everyone working so hard, and I realize that we are not alone. There is less fear because everyone encourages each other.
60% of osteosarcoma patients in Taiwan are treated at Taipei Veterans General Hospital. If patients can survive surgery and chemotherapy, they have the chance to start their lives anew. But many patients find it difficult to maintain their treatment due to factors such as hotel and transportation costs. So in July 2020, Wu Bo-gui, a physician at Taipei Veterans General Hospital's Department of Orthopedics, established the Taiwan Osteosarcoma Caring Association home.
Because many patients have to wait for beds and treatment, they need to stay here for a day or two. We provide an open atmosphere because we know that these children are treated for 10 to 12 months, and in Taipei, treatment happens in the hospital ward. That doesn't feel like home, so we provide an atmosphere that makes them feel like they're in a restaurant or back at home. During chemotherapy, patients and their family members can come here to take a breather and take a break. There is a priority order of admission here at the home. Top priority goes to patients who have to undergo an emergency operation or to children in the intensive care unit. As for other patients, we recommend that they make an online appointment 1 or 2 weeks in advance.
Osteosarcoma typically occurs in people aged 10 to 25. Wu says that if a person feels swelling near a bone, constant bone or joint pain, or if a bone breaks for no reason, it's imperative to make an appointment with a doctor as soon as possible.
The common problem we encountered in the past, which is also the reason why the association was established in the first place, is that many children experience bone and muscle pain. Parents and teachers think that these are simply growing pains. Some even take the children to get a massage or acupuncture. This lack of awareness results in late diagnoses. There are ways to identify potential signs of cancer. Generally speaking, bone tumor pain is centered around a fixed point. For example, if a child tells us, "I have a pain above the left knee," then be careful. But if a child says they have a pain on the left side and then a pain on the right side, those are growing pains. If a bone tumor is left untreated for a long time, you will see a lump or feel a lump. That's definitely not seen if it is a growing pain.
The association hopes to provide assistance to patients and their family and promote osteosarcoma awareness so that people can get early intervention. They also hope to provide psychological consultation to the patients and their family if needed. FTV reporter Stephany Yang and Zhongshu Hui in Taipei.